You're watching RedChip TV, your source for small cap news.
Welcome back to RedChip Small Cap TV. We're coming to you from San Francisco at the Meridian Hotel. Today's March 24th, and we've got teed up here for you another interview. We've got Pete Martinez. He's the Senior VP and Chief, give me the title, Pete.
Senior Vice President, Chief Technology and Innovations Officer
there we
for
go.
the Quantum Group.
I like that. Of the Quantum Group, that symbol is QGP. QGP, that's traded on the NYSE Alternext on there. And Pete, tell us about the Quantum Group. What does the company do?
We're in the healthcare, and right now there's no more exciting opportunity than to be in healthcare. One, you have an industry with a cost base completely out of control. The government has realized this. Second, the processes and the technologies already ready for execution. And third, the government is about to fund all of this activity. We in the Quantum Group do a couple of things. One, we're a health services organization. Physically, we sit right between the HMOs and 2,000 doctors. So in the state of Florida, we have 8 HMOs and the largest network of doctors, 2,000 in the state. But we do something very unique, which is we leverage technology in ways that have never been done before in the healthcare arena. Physically, we have deployed already the POWER platform, Personal Wellness Electronic Record, which is 100% consistent with Obama's play in terms of electronic medical records and integration.
You're right, it's an exciting space. Would you say that's what sets your company apart from many other players?
It is the unique combination of the two. If you look, for the most part, you have a lot of technology players, but with no delivery system into healthcare. And then you have a lot of health systems, but poorly leveraging technology. From the onset, our business model has been they have to go together. So our approach to market is through the health systems, we're actually integrating a fair amount of technology and doing it incredibly rapidly.
And talk about the size of this market and some of your growth plans.
Well, the market is $2.4 trillion in the United States, 17% of the GDP. But if you look at specifically the areas that we're going to, which is the inefficiencies or the cost issues related to the lack of productivity, that is estimated to be about $700 billion per year in the United States. Right. So the leverage of the technology and the health systems is actually to go at the inefficiencies. Don't ask for another dollar from the government. Actually dive into those inefficiencies and you find monstrous dollars, which in essence is your profitability.
Right. Right. Again, the Quantum Group, we're visiting with Pete Martinez here. That's traded over the NYSE Alternext. The symbol on that is QGP. And tell us a little bit more about your market penetration in Florida.
Yeah, in Florida we already have 3,600 lives that we manage as part of the management services organization. What that does is it gives us tremendous run-up in terms of the revenues for the business, which allows us to fund both the health services organization as well as the technology. In the last 12 months, we've been able to both launch the technology platform and gotten tremendous acceptance on it. We have also filed for 18 patents in the healthcare space. That's very unique. You will never find a healthcare organization that has anything close to that.
Right. Well, the electronic medical record, that's a big buzzword out there right now. And you guys are doing some unique things and use that as a launching pad to get a little bit more into the technology.
Sure. Less than 15% of doctors today use an electronic medical record system. For the most part, the systems that are out there have been a failure. They're hard to use, they're incredibly expensive, and they put all of the onus for integration, management of records on the doctors, which are ill-equipped in their offices to actually do this level of management. We changed the model and physically integrated all of the functions for the doctors. So the records management system, the billing system, disease management, electronic prescriptions, all of that bundled together, but in a web-based service. So there is no software that has to be installed. There is no dedicated hardware aside from a PC. And we actually host all of the information in the network. IBM does all of the hosting for us. So in terms of security and privacy, it's state-of-the-art.
State-of-the-art. And you're right, that's a unique approach, isn't it?
Very much.
Right. And then tell us a little bit about your background and the team's background.
My personal background, I retired from IBM a year and a half ago after 32 years. My last position there was Vice President of the consulting business and also the senior executive for the state of Florida. Our team, the executive team, is very, very rich in talent. Our CEO, Noel Guillama, has 20 years in the healthcare space, running multiple HMOs, health systems. The CFO has been with him the whole time. And one of our other senior vice presidents is an ex-president of one of the Johnson & Johnson divisions. So we're used to big plays. We've been very, very specific on the healthcare arena. I bring an awful lot of outside influence in terms of technologies that have worked in every other industry, bringing them into healthcare.
Beautiful. Again, we're visiting with Pete Martinez of the Quantum Group. The symbol on that is QGP. And talk a little bit about the future of the company and why our viewers should take a look at the stock right now.
Well, this is as exciting time as we're going to find. One, our revenues are tracking quarter to quarter in a very, very impressive rate. We just announced $7 million for this last quarter. That is a 32% jump quarter to quarter. Mm-hmm. Okay, and year to year, our jump was over 200% in terms of revenues. We are about to put that into very, very large play by the announcement now of the technology and the licenses revenues that will come from that. We physically are bidding into entire states that will leverage our technology for every doctor in the state connected through the same platform. So we have an interesting situation in the market. The demand is there. Mm-hmm. We have a very, very powerful and very well architected technology. And the doctors are going to get funded by the government. So through the stimulus packages and the medical home projects, the government is funding both the primary care physicians, the specialists, and now hospitals.
Sounds like kind of a perfect storm of a lot of things.
It's a wild time,
Right.
Demand is going to be an insane equation. We spent a lot of time explaining to doctors how the stimulus package actually works and how if they use the technology that has already been laid out, without any unique deployment of hardware or software, just web-based, they can actually capitalize on those dollars today.
Well, it sounds like the future is here. Everybody talks about the technology for the medical profession is out there, but you guys have made it all happen right now. It's available right now.
It's available right now, and we took very, very good care of it by first architecting the system. So it didn't make it look like an application, just another EMR or another billing system. We really studied the complexities of a doctor's office and try to simplify their life. What we tell the doctors is, look, you take care of the patient, we'll take care of everything else.
Right.
And providing web-based tools that, one, is very affordable because they don't have to pay for the internet. There's no startup fee, there's no closing fee, it's just monthly charges at a price point that they've never seen before.
Well, it's an exciting story, so please check out the Quantum Group. This has been Pete Martinez. The symbol on that is NYSE on the Alternex. It's a company that's the right place with the right technology at the right time. So thank you for watching Red Chip Small Cap TV.
This report is not a recommendation or solicitation to purchase or sell any security, nor does it constitute investment advice. Visit redchip.com for full financial disclosures on RedChip clients.